OT helps people with the things they need and want to do in their daily lives, things like these activities of daily living. In a nutshell, we help build skills to improve health, well-being, and satisfaction with life in areas such as school, home, work, and community. We do this by promoting a positive can-do attitude in order to help people overcome physical, emotional, or social challenges, promoting health and well-being, maximizing independence, improving quality of life, and helping others to grow. Through routine and habit forming, we help manage many conditions involving mental and physical health due to injury, illness, and disability. Telehealth is communication over a distance for health purposes. The idea of telecommunication with home-based healthcare has been around for a very long time, beginning in the 1800s when people would use their phones to avoid unnecessary trips to the doctor. This helped people who had difficulty getting into the care that they needed. There have been many medical advancements and health improvements in the 200 years since then, but the benefits have remained. Telehealth can reach people who don't have access to occupational therapy near them. People are living longer and wishing to stay in their homes more, so if they are mobility challenged, telehealth can greatly benefit them. It removes the barrier of distance from healthcare. Telehealth was usable for practice in less than 30 states in the US before the COVID-19 pandemic. It is now used in various ways in all 50 states. Access increased because providers, along with government agencies and insurance companies, helped to make sure OT services could be done with telehealth to reach more people. Legislation varies from state to state, but it is incredible that so many people were able to be reached. Medicare visits conducted through telehealth in 2020 increased 63-fold, from approximately 840,000 in 2019 to 52.7 million. Examples of policy differences. In Arkansas, telemedicine doesn't include communication that is audio only. Iowa includes real-time interactive electronic media, and also does not include audio-only phone calls for telehealth. Illinois insurance companies are required to reimburse for telehealth services that are provided, and that includes audio only. Telehealth policy changes for Medicaid, professional regulation, and licensure compacts. Telehealth policy updates across some states are mostly centered on Medicaid reimbursement, professional practice regulations, and licensure compacts. Some examples include California, which has extended Medicaid telehealth waivers and flexibilities created by advocacy group to evaluate long-term telehealth protocols for billing and authorizes Medicaid remote patients monitoring coverage. Colorado enacted the Occupational Therapy Compact and the Audiology and Speech-Language Pathology Compact. Maine and DC joined the Psychology Interjurisdictional Compact and Occupational Therapy Compact. With telehealth, there is flexibility to access which gives people more control over their own care. It also makes care more affordable because it doesn't require transportation. Among our grounding principles of beneficence, non-maleficence, autonomy, justice, veracity, and fidelity are clear ways to protect and inform telehealth clients. Guarding their data is very important since their information is electronic and potentially vulnerable. Ensuring that the benefits outweigh the risks is also necessary, though full disclosure and helping them understand their rights must be a priority. When working in telehealth, it's necessary to be adaptable and keep up on the latest technology to have all the tools you need to help your clients be successful. Keeping the person, environment, occupation model in mind will lead to better outcomes since in the home is where most of our time is spent, so it makes sense that doing the actual tasks is better than a simulated task or environment. When keeping the environment in mind, realistic options for therapeutic intervention are more meaningful because what they will be doing in therapy will translate to their daily living effectively. The thing that surprised me the most is how much variation there is among the states. It makes sense that the decisions can be made at the state level, but researching and trying to understand the complexity of the state and federal policies left me with more questions than answers. There seemed to be disagreement over state licensing and Medicare reimbursement rules, so in my opinion, it would be better if there was more uniformity. The AOTA takes the position that when a practitioner decides that telehealth is clinically approved, a mandatory initial in-person visit is restrictive and should not be required, so that is one thing that could improve telehealth if all states could agree. I am grateful for the advancements in telehealth in general because I have utilized video appointments for simple things in the past. I can see the many reasons why a person would benefit from this convenient tool of therapy, and I am hopeful that more people will be able to be reached. If I were to think about the future and what telehealth could be, it seems like there is a lot of potential for an immersive environment through virtual reality. The AR could also be a simulated environment that could help someone work on their goals in privacy and safety. I wonder how it could help people who are homebound feel more connected, or if it would be able to be useful to a person with a neural problem to have beneficial interventions by providing exercise or a fun game to challenge them cognitively or physically. I also think AI is going to be very popular with taking on-the-spot notes. There is caution that needs to be heeded, but it would save so much time and get practitioners back to other aspects of client care. I don't know about you, but documentation is something I want to already be fast and great at, but I know I have a lot of learning to do before I get there. I don't want to have to write an intervention for my own time management. I also wonder if there might be a way to use webcams to help with movement, assessments, or fall risk based on gait or other patterns. I'm excited for all the possibilities with technology, and I can't wait to see what the future holds. Thank you.